Welcome to Ending Age-Related Diseases 2020. This conference brings together the biggest player in the field of longevity research, scientists, biotechnology leaders, investors, and of course, all sorts of activists and early adopters. And I hope that if we work together really, really hard, we will be able to create longevity therapeutics in our lifetime, and hopefully we'll enjoy a very, very long and healthy life. So scientific research in medicine has a very long history of self-experimentation. When scientists wanted to try something new and something that possibly could be dangerous, they were often experimenting on themselves. And then by gathering this initial data, they were able to design better experiments and then involve volunteers. Now, thanks to the increasing accessibility of various treatments and also various diagnostic tools, biohacking, self-experimentation, quantified self may become a very important part of the scientific progress. And so let's dig into the current possibilities and let's talk about the future of preventative medicine. I'm very glad to be joined today by Stanislav Skakun. He is the founder and CEO of the analytics project Biodata, and also one of the most prominent Russian biohackers. Hello, Stanislav, how are you?
Hello, Elena. Thanks for bringing me here. And I'm fine, and I'm looking forward to discussing all these questions you touched upon.
Wonderful. So, if you could share with me, what first sparked your interest in the field of healthy longevity and life extension?
Well, I think that I first got interested in the idea early in 2001, so just in the beginning of the century. At that point, I realized that the biotech is rapidly developing, and we are getting hold of new technologies which may change our life dramatically. But at that point, 20 years ago, when I looked around and when I tried to gather some information, and of course internet was available at that time, so I was looking for people across the world who were doing some things in biotech, I could not find any possibility for a regular person to enter the field, so to say. So the barriers were very high. You was supposed to get higher education in biology, was supposed to consolidate significant financial resources to start doing something for yourself. So I kind of postponed that interest for 15 more years.
Wow.
I only recently, like 6 years ago, I decided to reiterate to re-enter the field and started looking at what had been actually done in those 15 years.
And, okay, and why did you decide to begin with such a deep investigation of your biological parameters and measuring everything?
I think the main reason is that I'm very interested in data and measurements. That's just the way I see the world. I should say here that I'm a financial guy. I worked all my life in corporate finance, and I was engaged in financial analysis and M&A deals, and it was all about figures and collecting data. Mm-hmm. It was very natural for me to think about human body in pretty much the same way, that we should collect some data and find out how it works, even if we do not know everything about that. Right now, then we should, the best way we can proceed is to start collecting some data. That's the main reason. The second reason was that, of course, when I was like 30 years old, I started feeling some limitations of my health. So I started, for example, to get more tired more easily. I couldn't work as much as I used to in my 20s. But you see, I don't think that's really the reason why I started set on my way to biohacking, because all people actually experience in their 30s some limitations. But not many people actually do things what biohackers do. So I think that the reason why I am interested is just my personal attitude with figures, with numbers.
I see. Oh, that's interesting. Before we begin, because everyone has their own understanding of what is biohacking, could you please give me your own definition? What is the rational version of biohacking?
For me, biohacking is trying to control your biology with evidence-based methods. So it's as simple as that. So you're trying to control your biological limits, biological possibilities, opportunities, and you use scientifically based methods, and not, for example, horoscopes, but rather biochemistry and genetics. If you put these two together, you may want also to add that biohacking is very often about some uh, amateur, non-professional biologists, enthusiasts. Most of the guys in the field are not biologists or medics. That's also the case with me. These three things you should keep in mind when you speak about biohacking: controlling your biology with evidence-based methods by non-professionals.
Well, it sounds very similar to the definition of evidence-based medicine. So in your opinion, what's the difference between biohacking, evidence-based medicine, and say, just healthy lifestyle?
Well, there is a huge difference, I believe. Let's start with the difference between biohacking and medicine, evidence-based medicine. Medicine mainly deals with pathology. When to enter the field, to interact with a medical organization, with a doctor, you should have some certain complaints, you should have some certain symptoms, you should have some disease formally described about you. So if you are kind of a healthy guy, you can't come to a doctor and ask to do anything with you, because because if you are a healthy guy, any action can actually do you more harm than good. So for a doctor, if you look like a healthy guy, walk like healthy guy, talk like healthy guy, the doctor must not touch you. It is even prohibited by the medical standards, because any intervention can actually be harmful for you. There is always a risk, and the doctor will never take the risk of working with a healthy person, so to say. So there is for me, there is a deep and fundamental controversy that we will never have preventive medicine. Actually, we will never be able to achieve preventive medicine, because medicine in its essence always deals with disease, and you will never be able to change this style. You should always have the disease first, then you should be working in the medical with the medical methods. I'm a non-believer. I'm a non-believer in preventive medicine as a field. I'm rather a believer in a participative approach of a patient when he is trying to prevent the disease, to collect some data about himself, and to change the trajectory he's moving on, to avoid the disease becoming actual. Why I believe that it is possible? I believe that's possible because health and disease are not some discrete states which kind of turn into each other by a switch. You do not push a button to become a ill guy or to become a healthy guy. This is a very long process which takes months or maybe years. And if it's so long, then there must be some biomarkers which tell you in advance that the disease is coming, and then you can act. But there is that issue that medicine always deals with the actual disease and will never be able to do any interventions on healthy people, because that's a risk. There is always a risk which offsets the benefit. There is another difference between biohacking and evidence-based medicine. As you know, evidence-based medicine is called evidence-based because it is using randomized controlled studies with placebo control, and you take a huge cohorts of people, and you give placebo to some cohorts, you give actual treatment to another cohort, and you see the difference, and you can make you can make cause and effect conclusions from that. That's the reason why evidence-based medicine works this way. In biohacking, you sometimes rely on functional understanding how things work. For example, I will give you a personal example if I can.
Sure.
I have a condition which is sometimes called osteopenia, which is decreased density of the bones. So when I was trying to tackle this condition, and I should remind you that I'm 37 years old, so at this age I should not have it. It's not.
Yeah, it's too early.
It's not in the medical standards, so nobody would be able to even designate this instrumental analysis for me. I had to do it myself from my own intention, on my own intention. So I myself discovered that I have this condition without a doctor. So it was a voluntary action, because no doctor will be able to designate that for me. And then I started looking for some means how to prevent this condition, how to get back to normal state. And I couldn't take, for example, the risk of taking bisphosphonates, which are the most widely used drug for this case. So what I ended up with, I ended up taking boron. Why did I take boron? Because we know from functional biology that boron is significant and important for the density of the bones. It is an important nutrient for trafficking calcium into the bones. But there are no randomized controlled studies on using boron in preventing osteopenia. So I had to do some things without RCT. I had to do that because of my, some knowledge of biology, which I collected over the internet, so to say. Therefore, my action was scientifically based. It was somehow evidence-based in some way, but it was not evidence which was part of the evidence-based medicine. It is not, it's not magic, it's not horoscope, it's not fortune telling, but it's not the golden standard of how evidence-based medicine works. And there is another huge fundamental controversy here between evidence-based medicine and personalized medicine. In the evidence-based medicine, you rely on evidence which was good for 10,000 people. But in those 10,000 people, 5% were, for example, non-responders to therapy. They had some reasons why the therapy didn't help them. I'm very much interested in this 5%. I'm very much interested in why these 5% did not respond to the therapy. And this is what personalized medicine works with. It works with this thin tail. The people which are usually discarded, the fates of people which are usually discarded by evidence-based medicine, and it is believed that the therapy is good enough if it helps 95%. I'm very much interested in those 5% which are non-responders. So you see, there is a huge difference between biohacking and evidence-based medicine.
I guess I could agree. And I think that to some extent, it probably stems from the paternalistic approach of the traditional medicine, because the doctor is believed to carry most of the responsibility for the outcomes, while the patient is considered someone who is just receiving the treatment and not actually investing a lot of effort into becoming healthier. It should sort of happen automatically for him. So I think that's one of like the root causes why we are in the current situation with the modern medicine. And it's good that you mentioned the personalization and how important it is, because apart from biohackers, there are also people who call themselves e-patients. Those people tried to get help from the traditional medicine, from evidence-based medicine, and sadly, the system failed them. The reason is their condition just happens to be so difficult to understand. It probably has so many aspects, unusual aspects, individual aspects. There are too many factors involved in the picture, and the doctor just can't possibly come to a definitive conclusion what the therapy should be to help these patients. And these people have to dig into the scientific literature, and thanks to the projects like Sci-Hub by Alexandra Elbakian, now they have more chances to find interesting information about themselves. So that makes me think that you're right, and probably the preventative medicine will not come before personalized medicine will become a reality. So that's kind of bring us to our next question. With your like 600, 700 tests that you're doing on yourself every month, what's the goal of your self-research and self-experimentation? And if you could speak about it, what are your best achievements so far?
Let me say a few things about what I do actually, and so that maybe it becomes more clear.
That's very interesting.
So every month I go to the lab and give away about 10 to 15 jars of blood to collect some 300-400 biochemical biomarkers of my body. Not only blood, of course, some other biological liquids as urine, saliva, and so on. The total number of biomarkers that I track now is around 900. So it's almost 1,000. So some of these 900 biomarkers I do on the monthly basis. For example, complete blood count, I do it monthly. But some of them, for example, maybe some gastrointestinal markers, for example, maybe some cardiovascular markers, I track like once in 4 months. But in the period of 4 months, I measure every biomarker from 4 to 1 time. So in every 4 months, I measure 900 biomarkers at least once. I do this because I believe this is a great tool to control your energy, to control your quality of life, to control your health. And if you do sports, for example, it's a great tool to track your progress in sports and all that stuff. I also take a lot of supplements. So I have a lot of data. So when I take some supplements, I can track whether they are bioavailable. So you may be taking zinc, for example, but I tested like 5 different supplements with zinc before I found one which was actually bioavailable. So that was a small study in itself to find the supplement which is bioavailable, to find the form which works for you. So I take around 30 supplements per day currently, and I do this for like 5 years, I think, for a long time. And these supplements are personally tailored for me. So don't ask me which supplements I take, because you won't need it probably, because they are personally tailored for my case, for genetics, for geography where I live, or for some other reasons. So I have a lot of data on myself. I take a lot of actions to control my biology. That's what I basically do. And I go a long way to achieve this goal. And I develop these instruments to make them more efficient, more productive, more informative for me. What is the main outcome of this experiment? I want to make very clear, maybe maybe this must be the one single thing that everyone should remember after this interview, that the main outcome of the experiment is that I have a lot of medical data on me. The total number of medical measurements over the last 6 years is more than 12,000 medical measurements of myself.
That's incredible.
And, this is a huge data set. I believe that's kind of top 3 in the world. So this experiment is about top 3 detailed quantified self experiments in the world. And of course, this data is the best and is the most important result, because we can use it to somehow tackle the risks for my health. I have identified around 50 anomalies in my body, in my organism. These anomalies were not disease, are not diagnoses, as a doctor would put it. They are rather anomalies which may or may not in the future result in some deterioration of my health. I was, I suppose, and 6 years is a long, actually is a long run already. So we can be discussing some results of this experiment already, some intermediate results. More than 90% of these anomalies, more than 90% of these risks are put under control. So almost all of them are under control. I can see that from biomarkers, from my personal subjective feelings, although subjective feelings is not something I really rely on. Rather, I would say that based on the objective measurements, these risks, these anomalies are under control. That was the concept, that I would be able to do that. So this is already a proven concept. I have proved that you can identify a lot of risks and you can control them through a regimen. You can do sports, supplements, some other dieting, some diet, and you can control all that risk. And also, anyone has these risks. I mean, it's not me who is so ill or so sick that I have this risk. Everyone has this number of anomalies, but they just don't know it. I'm the one who knows it, and I have shown that we can put this under control. You could ask me if maybe about my biological age. That's concept often arises when we speak about
that will be a
biohacking.
very interesting question.
Well, I should tell you that my biological age, based on different methods, I calculated by different formulas, and there are a lot of methods to calculate it, is around 26. So I'm around 11 years younger in biologically speaking than I am based on my passport data. But I can put it another way for you. As you remember, we start to age at somewhere around 25. That's when our mortality rate is starting increasing. So you can say that I'm not aging. So I'm 25 years old, 26, sort of say 6 years later when I started my experiment. So I have been able to kind of stop this process. Well, I'm joking right now because although the biological age is really 26, I know that I have not stopped aging, because aging is something more fundamental, and we will be speaking with you, I hope, in like 25 years when I'm like 60. And on that point, it will be interesting to discuss which processes are under control, which are not under control, because after we strike 50 years, the aging kicks in very quickly, and we get old very quickly after that age, after 50. So let's speak in like 25 years again about that. I want also to show you, I want also to tell you about another important result of my experiment.
Yeah.
As I said, I used to be a top manager of a big Russian accounting company, the biggest accounting company in Russia and CIS. So CIS is a former Soviet Union, for those who didn't hear this abbreviation. For 1,000 of accountants work for the company still, and we helped our clients to keep accounting. And I was a CFO, Chief Financial Officer of the CIS operations. As you can imagine, this is a very risk-averse guy who is sitting in his room, only looking at Excel figures and never wanting to see anyone. When I sat on my experiment, I realized that I no longer want that fate. I realized that I want to speak up at the conferences. I realized that I want to start a company, a startup company, which is connected with a lot of risks in Russia and everywhere. It's always difficult to start a new business and start looking for clients, especially when you are not a salesman, not a salesperson. If you're a financial guy, this is a huge transition from the introverted financial guy style of life to being an entrepreneur. I believe that's a very important result of my experiment. And what's the fundamental cause here? Why did this transition happen to me? When you take someone who is risk averse, who is scared to do something new, who is hesitant to communicate to people, if you know such people, you should take them, take 900 biomarkers of these people, fix them, and they will become outspoken, extroverted entrepreneurs. They start companies. They will become more productive, and they will not be satisfied. They will not be satisfied with the space they occupy. They will want to expand. They will want to find something new and see something new and create something new. What I'm suggesting here, what I mean by this is that a normal person, a normal human being, is always, I'm sorry, and a normal, healthy human being is always how to say it in English, curious about what's coming in all around, and is always eager to explore.
Yeah, I guess.
And that's if you are not feeling that, you should be taking some blood tests to find out why.
Do I hear you saying that actually you have found some peculiarities in how your body works that could actually explain that why do you have a certain lifestyle? And once you've sort of started fixing those things and gathering control over your body, that changed sort of how you deal with the world?
Absolutely, exactly. So most of our, so to say, character traits are projections of our biochemistry. And if you track your biochemistry well enough, deep enough, you will be able to change that. As I mentioned, I'm a founder of the company. So what we are doing is we are medical assistance company. We are not a medical company. We're helping people to find the medical teams. And we specifically work on this product of transforming people from biochemical parts, from their biochemical point of view. So we organize checkups to check those areas of health which may be connected with how you feel inside. And then a doctor, usually endocrinologist, will be looking into the biochemical markers and help you achieve more energy, more active involvement in your work affairs. Maybe a guy might have anemia or depression or a low vitamin D, and this will explain why he's burnout at work and all that stuff. I'm very much convinced that like 95% of mental disorders or like mental
Complications.
yes, complications we experience, they are rooted in biochemistry, and we should first set on testing people thoroughly to find out which areas will lack sufficient nutrient support, or maybe there are some other issues with health, and then we should bridge this to well-being, psychological well-being.
That's a very interesting point of view, even though I should note that it's highly unconventional to think that by fixing your biology, you can actually make a person a better achiever, a more successful person, and so on. Though, in retrospect, it seems logical, right? Because, for instance, the markers that indicate inflammation are closely related with the markers that indicate depression. So that much I know, right? So yeah, that actually could work. That's a very interesting service, and I hope that you will be successful in offering the service to people. We definitely need more achievers, more doers, and people really should be more enthusiastic about life right now, because it's offering so many opportunities for growth and development and self-exploration and self-realization. So that sounds very interesting. What can you tell about the role of the approach that you are using right now in sort of prototyping the medicine of the future? We have touched a little bit the question if preventative medicine is possible, how personalized medicine can help with that, and so on and so forth. But what I want to hear is your opinion, just how much you see this approach that you have right now for yourself to be widespread in the future and become part of a normal, ordinary kind of medicine, affordable and accessible to everyone.
Well, we do rely a lot on participative approach of the patient. So yes, I would agree that we are prototyping some medical service of the future. Our service is IT based, so it's an online account where you can interact with the medical teams. We try to package our programs so that a person can easily understand what he needs. For example, energy or sports or total quantifying the body. So we're trying to find these to translate medical diagnosis, so to say, in practical terms, so that people may not know that they have diabetes, but they may want to control weight, for example. So we're doing this translation. So that's why do we need it? Because we are not a medical company, and we need people to give us an order to act. So we can be we can only help when somebody tells us what he wants. And then we can act as an intermediary to connect a person to the medical team. And this is maybe the way the future medicine may work. So we need a layer of intermediaries between the population, general people who are not who do not want to spend many time working on their health, and between the medical teams. So the economical benefits will be huge, because when you prevent some disease, you will save a lot of money later on treating it, because as you know, chronic disease like cardiovascular disease, dementia, and all that age-related disease are very expensive for the state, for the insurance business, for the medical organizations to manage. So yes, I would agree that we are working on some of the prototype for the future, but I see some downturns and some risks here, whether it will be widespread. The third thing is Russia is a very good sandbox for spawning such services, because in Russia you can come to the lab, and you can on purpose, on your intention, do any medical test that you want. That's not the case with the US, for example, and that's not the case with Europe. Most of the countries of Europe, they do not allow you to come to the lab and order any tests. Mostly medical experts can do that. Otherwise, it's very expensive. In Russia, it's not expensive. So one reason is that in Western countries, there is a huge barrier for people to enter the field of testing themselves. The other reason why I see, the issue why this practice may not be widespread in the future is that actually 95% of people, they take health for granted. It's some resource that you just have, and you will not be doing anything unless you actually feel ill. And that's not about, so to say, stupidity or some blindness about the future. That's not it's not that we should educate the people. It's different. Maybe you have heard about the system 1 and system 2 in taking decisions. System 1 is something which works very quick and makes you react in the seconds. And system 2 is something which is dealing with rational evaluation and analysis, and you can take long-term decisions using your system 2. So evolution designed us so that we actually think about what's happening tomorrow and today in the evening even, but not about something which is happening in 25 years. And it's not about blindness or stupidity, it's about the nature of our psychology. We will never think about what is happening in 25 years. If you decide, for example, to start a corporation which would be based on the idea that in 25 years we should prevent some disease, you will fail. The corporation will go bankrupt because there will be no market for this corporation, because 95% of people will always choose postponing health issues until they actually strike them. And this is very important business consideration about the market size. If you are a small startup company, you can always find a niche. You can always find clients. If you are digital, if you don't have fixed costs, if you scale quickly and reach out in any country, you can survive in this market. But generally speaking, we will not be having a big market for preventive medicine for a long time. I do not see how we can overcome the millions of years of evolution and teach people to think preventively.
I know that it's very hard to give general advice for someone, but could you please tell like 3 tips that you as a biohacker could give to people when it comes to extending their healthy life, or at the very least controlling their health and maintaining their health, like something that worked well for you?
Well, my first tip will always be to start collecting the data on your organism. So that is if you do not start doing that today, tomorrow you will not be having a data set which will be suitable for personalized medicine. So for personalized medicine, you don't need data of other people. You need your own data. You need to start collecting it today, tomorrow, yesterday. And then the second tip will be to look in the direction of energy and emotions, how they are controlled by our biology. So specifically, very important data for you will be the nutrients, hormones, neurotransmitters, iron, anemia, all that stuff. So you should try to establish understanding of what drives your energy and increase it. And after my third tip, after you increase your energy, reinvest it in biohacking. Thank you very much, Elena, for bringing us here today, and I wish you to make a great impact with this conference and to attract more people to the concept of preventive medicine and awareness of the health risks, and of course scientific discoveries which are there to be made and are being made as we speak here. So wish you all best luck in what you do.
Thank you very much.